Hi, hello. My name is Jorge Cambronero, and I'll be your student nurse for today. And what is your name?
My name is Mauro Cambronero.
Alright, I'm going to verbalize that type of privacy for the patient. There'll be curtains, they'll be around if there's an actual hospital room, or the door will be closed. Also going to verbalize washing my hands before and after any assessment that we do. And so we're first going to start observing the patient's appearance. Hygiene, skin color. The patient appears to be well dressed. It's not disheveled. There's fine. The skin color is a fine complexion. There's no blemishes in the skin. Next going to be his body structure, stature, and his nourishment. His body seems to be well proportioned. No abnormalities. Nothing misproportioned. We're going to go to his mobility and his posture. He sits upright, relaxed. In his mobility, he came in the room before this and he was able to walk, sit down properly, so nothing wrong there. Next would be assessing his mood and effects. So his mood appears that he's fine. We're going to ask you how you've been feeling.
I feel okay.
And what do you feel right now, your effects?
Right now, I feel fine, just have a little congestion.
Alright, so this is mood and effects. And next we're going to look at his ability to hear and to speak, and as evidenced by our conversation, he's perfectly capable of hearing and speaking. And next we're going to assess his level of consciousness. We're going to ask him a couple questions. So can you tell me your full name, please?
My full name is Mauro Cambronero.
And you know what is the date?
The date is July 23rd.
Do you know where you are right now?
Right now I'm at the living room.
Okay. The house. And do you know who's the current president of the United States?
Joe Biden.
Okay. So the patient is alert, aware, and orientated times 4. There's use an EMS and EMT. So there's times 4 AAO times 4. So next we'll start to assess his systems: the head, neck, eyes, mouth, nose, and inside the mouth. So I'm going to start by palpating his head, assess for any sort of tenderness, pain, sore spots. Just let me know if you feel anything. There's nothing. I'm going to go ahead and use a pen light. I'm going to look at his ears. Go ahead and lift his ears, straighten out his ear canal. The canals are patent, no impacted cerumen, like that. We're going to look at the other side. Straighten out his ear. There's nothing there, it's clear, patent. I'm going to go ahead and assess on his face, his frontal sinuses. I'm going to check for any sort of tenderness and pain, if there's any, and the maxillary sinuses. And while I'm there, I'm also going to check for any lymph nodes around the back of the maxillomandibular. And let's check for any tenderness there. There's none. Is there none?
Not feeling anything.
Nothing? Okay. I'm going to go ahead and assess his eyes. I'm going to check for his cranial nerves 7 and 12. So go ahead and just look at my pen. Alright, I'm going to assess his pupil reaction. Just look at my finger. Alright, I'm going to go ahead and assess his conjunctiva is clear, equal, so it's sort of red due to his allergies. Sclera is clear, transparent, fine. Irises are flat, transparent. There's no abnormalities in his eyes, so his pupils are equal and reactive to light. Accommodates. Alright, and next I'm going to go ahead and check the nose. Just use a light look up. His mucosa is pink, clear. I'm going to go ahead and test the patency of his airways. You can go ahead and test each side to see if it's any sort of if it's clear or not. Are your airways clear, or is this clogged?
This one is a little bit clogged.
So your left is a little clogged. So his left airway is clogged. I'm going to go ahead and observe his mouth. His mouth isn't dry. There's a moist. It's fine. Go ahead and open your mouth. Go ahead and look. His teeth are all intact, straight. The gums inside his mouth are clear, pink. Now it's hard plates, soft plates, fine. His tongue, pink, clear. Go ahead and stick your tongue out and go, Alright, there's a uvula, so there's a movement. His greatest tonsils is at a +1. Alright, so I checked his front, his nose, his eyes. I'll go ahead and test for cranial 7 and 12. I think I began to talk about it. I didn't do the facial expression, so go ahead and smile for me. Go ahead and clench your teeth. When you close your eyes, clench your eyes. You wrinkle your forehead. Can you stick your tongue out? You go left to right. And can you puff out your cheeks? Alright, so his cranial nerves 7 and 12 are intact. I'll go ahead and palpate his neck. I check his neck for any sort of tenderness, sort of pain, and let me know if there's any. Alright, I'm going to test his range of motion in the neck. You push against my hand. Alright. Push against this one. Alright. Push against the front. Alright. And against the back. Okay, thank you. And then I'll go ahead and check his carotid pulse and assess from both sides one at a time. His strong bounding pulses in both sides. And that's it. It's finished.